everyone! I'm Angeline Ramos Simon, a third-year student of Emilio Aguinaldo College, School of Midwifery. Today, I am going to perform surgical hand scrubbing or surgical hand washing. But before that, let me first define you what is surgical hand scrubbing. Surgical hand scrubbing is the process of removing as many microorganisms as possible from the hands and arms by mechanical hand washing and chemical antisepsis before participating in any surgery. Prevents possibility of contamination of the operative wound by bacteria on the hands and arms. It also removes soil, debris, natural skin oils, band lotions, or transient microorganisms from the hands and forearms of the sterile members. Attitude: displays proper grooming and wears complete well-pressed uniform. Observes proper decorum at all times. Procedure: Number 1. Turns tap on. Regulate the flow and temperature of the water. Number 2. Pre-tears package containing brush and then lay the brush on the back of the scrub sink. Number 3. Wet hands and arms for an initial pre-scrub wash. Use about 5 ml or 1 pump of surgical detergent. Work up a heavy ladder up to 3 inches above the elbow for 30 seconds. Number 4. Rinses hands and arms thoroughly. Allow the water to run from hands to the elbows. Number 5. Soak fingertips and clean the spaces under the fingernails of both hands using the nail stick under running water for 15 seconds. Discard the first nail stick and get a new one for the fingernails of another hand. Discard the nail stick. Number 6. Get the sponge and lather the fingertips with the sponge side of brush. Using bristle side of brush, scrub the spaces under the fingernails of one hand, 30 circular stroke or 15 seconds of each hand. Number 7. Lather digits. Using a straight stroke going away from you. Scrub 20 stroke on all 4 sides of each finger for 1 minute, beginning with the thumb or little finger of one hand. Number 8. Lather palm, back of hand, and heel of hand. Scrub on each surface with 20 circular strokes. Number 9. Ready to scrub the forearm. Divide arm in 3-inch increments and use the sponge side of brush lengthwise to apply soap around the wrist. Scrub 5 circular strokes on each of 4 sides. Move up to the forearm ladder, then scrub up to 2 inches above the elbow. Discard the first brush. Get a new brush for another hand. Number 10. Repeat step 6 to 9 for the another arm. Step 6. Step 7. Step 8. Step 9. After repeating step 6 to 9, discard brush. Number 11. Rinse hands and arms without retracing or contaminating. Number 12. Allow the water to drip from the elbows before entering the operating room. Number 13. Let the circulating nurse turn off the tap.